Community Viewpoint.
Hi, welcome to Community Viewpoint. I'm your host for this segment, Maria Guerra. It is good to be back, and tonight we have some awesome information for you from Brent Levitt from Battleborn Financial. Welcome.
Thanks for having me here today.
Well, thanks for coming up. So we've been trying to get you up here for a couple years since you started your business, and now you're just like in full swing, right?
Yeah, definitely.
So tell me about Battleborn Financial. Just tell me a little bit about what is the company?
Yeah, so we've been in business about 2.5 years here in Pahrump, and I'm actually a certified financial planner, help you with our finances and financial needs, and we also do health insurance. We manage a lot of people's individual health plans, anywhere from under 65 through the exchange to Nevada Health Link, all the way up to Medicare, and we'd even do some small group health insurance policies here in town and manage the benefits for companies. Okay, so like Medicare opt-out insurances or like Medicare supplement plans, or both? All the above. Okay. Pretty much everything we do in my office. I have another 3 different health insurance agents in the office that work with us too. And that's awesome. We help people. We let people either walk in or we manage their business plans, things like that. So. All right. Have we run the banners yet? Yeah. Okay. So you saw the phone number on the screen. Where are you guys located? We're on the corner of Basin and 160, right next to the Home Depot. Right in the middle of town. Yeah, right. Pretty easy to get to us. We're right next to the attorney's office right there, and really like that. So it's pretty easy to see us right there in the corner. Look for the guys in ties. Well, I'm usually wearing a tie usually, just special for the show tonight. Yeah. So how long have you been doing this for? I've been in the industry since 2010. Okay. Quite a while. For a while, a little time frame, but our business we've been here in Pahrump about just over 2.5 years, so we're going pretty strong here, and this community is really great to work with. And I've lived here about 4 years, and there's a big need, and we don't have as much. There's just so many people that really need help with especially their health insurance and their finances and stuff like that. So it's really big. Well, the thing about health insurance is it's not easy to navigate, so you kind of have to be a little bit savvy to navigate it, and if you're not, you need somebody to help you. And so it's nice that you're here local, because most people, you get insurance and you have to either talk to somebody on the other line or you have to chat them and online, and especially for seniors, that's not something that they're used to doing. Yeah. So have you seen that it's easier, that they're happy working face-to-face? Oh, yeah. Well, there's big changes coming, and there's some big misconceptions about what's going on in health insurance. There's, I think every week we get somebody in our office that came in that bought they got scammed. I call them more scams than anything. They get a call on the phone from somebody trying to sell them insurance because they don't realize there's local resources here to talk to actually somebody in person. So they go online, they put their information in looking for just quotes for insurance. And next thing you know, their phone blows up with 1 billion different people calling them, trying to say, hey, buy this new PPO plan in your area. We're taking enrollments outside of open enrollment. You can enroll anytime. And what they don't tend to tell the people is, well, these are insurances. They're not real health insurance. What they are is just limited benefit plans. Yeah, you can go anywhere you want to go to see a doctor, but the insurance isn't going to pay you much. It's limited in benefit, and so they're going to pay maybe for a copay for a doctor, but if you need to get a prescription done, to get your physicals done, or if you have a pre-existing condition, you're kind of on your own. So that's the downside to those limited benefit plans, and so you got to be very careful of who you're taking on those programs. And then we also see a lot of, and then they come in after the fact when they need some major medical done, and it's like, now I need real insurance. Well, in the real marketplace, there are certain times we're allowed to buy insurance. We have open enrollment every year from November 1st to December 15th for anybody under 65, not on Medicare. That's when you're allowed to enroll for health insurance for the new year. And we only have a limited amount of plans that are actually available that really do cover pre-existing conditions, that cover all your medical needs, that are actually registered with the state of Nevada, and they're legitimately sold here in the state. In fact, this year, when the news were getting a new insurance company, Anthem Blue Cross Blue Shield, decided to file new rates. It's not 100% in stone yet because they haven't signed final contracts yet, but we're going to have possibly now 3 insurance carriers to pick from here, which is great, instead of the 2 that we've had in the past. And then we have and then also, a lot of people don't realize that insurance is actually more affordable than they think.
most people are under the impression that insurance is super expensive, which it is, but with the Affordable Care Act, there are actually resources. We have this program called Nevada Health Link. We've been using healthcare.gov's platform the last few years, but the state actually came in this year and has revamped it, and they're redoing everything under their own label. In fact, we have a grant from Nevada Health Link this year. They give us a grant to be able to help advertise it a little bit more and let people know that we're a local resource for people to help get enrolled through that health insurance in that new marketplace. And people are able to get tax credits that make their insurance a whole lot more affordable. You know, think of like a young, a single person making less than $46,000 a year in income can get a really affordable insurance policy because they qualify for those tax credits. Or a family of two making less than $65,000 a year can qualify for a tax credit and make it more affordable for them. And you'd be amazed what the rates people find. They get these scam plans. They find out I got it because it's cheap, and they come to find out
there's no tax breaks.
Yeah, there's no tax breaks. And they find out these new plans are a lot more affordable.
So here, listening to you, it brings me to a couple other questions. So, what is the most important thing for somebody to ask when they're buying a plan? Like, is it because they don't know the difference between like a regular insurance or a limited benefit plan, which it's basically what it says, limited benefit, right? So a lot of times, like when you're talking about like buying text messaging things for your business, and somebody says, well, some carriers don't accept short code messages. When I first heard that, I was like, well, what is a short code? So then going over to insurance and hearing like limited benefit plan, like what's the best thing to tell someone? Like, what is the easiest question for them to say they do get these calls, besides like, hey, stop calling me,
Yeah.
Like what can shut that down? Or I mean, if they did need one of these other plans or whatever, what is the best thing for them to ask?
Well, first of all, just
so they know it's
if
legitimate.
If it's not one of three names, if it's not Health Plan in Nevada, if it's not Ambetter or Silver Summit Health Plan, or Anthem, if they're saying terms like multi-plan or PPO stuff, which unfortunately in Nye County we don't have any PPOs available to us this year, they're more than likely probably not real insurances, just off those terms alone. And then if you ask the questions like, do you cover pre-existing conditions? So if I have cancer now,
a good one to
if
ask
I have
them.
cancer today, are you going to cover my cancer tomorrow? They're typically going to have to tell you no. And legally, if they are trying to sell any kind of insurance type product, they say on there that this is not real insurance, this is limited in benefit and scope. The actual policy will tell it to you. If you're on the phone, they're trained to lie and manipulate, and they're not going to tell you those things. Because they make good commissions off that. So those are big things to look at.
I mean, that's something that I've never been comfortable with, buying stuff on the phone. Even when I changed, my mortgage company changed, and a guy called, and he's like, hi, this is so-and-so from the mortgage company. Can you verify your social security number? And I was like, click. and then another lady called me, hi, this is so-and-so from your new mortgage company. We're going to need to verify information. Click. So then I got a letter from my old mortgage company saying, okay, this is who your new mortgage company is. But instead of those people like explaining it, like, I'm not giving you my social security number over the phone. So are those kind of red flags when they start asking for this information and they haven't really given you any concrete? I think probably a good rule is just make sure you're in person, or that you are calling a reputable company, right?
Exactly. And anybody that mentions that they work with Nevada Health Link is going to be legitimate. Usually when we're dealing with Nevada Health Link, that's the state agency. That's the state. They're actually a broker with the state of Nevada, and they're registered, and they have to go through a lot of training and be actually certified with the state to be able to sell those plans. They're not just somebody that's in a call center in Florida somewhere else.
So maybe somebody visited like a social service fair, like Nye County Health and Human Services has a social service fair. So if you visited the social service fair and then somebody calls you and says Nevada Health Link, then you know it's
probably
legit.
more likely it might be more legit.
Or you can go right over to Battleborn Financial.
Yeah, you can walk into our office and we'll help you out as well. We have actual agents that are licensed to do that.
That's awesome, because before it was just, I didn't mean to cut you off, but there was there was people that would help Nevada Health Link, but they were like employees of the state and very limited hours. And so what's your hours at the office?
Well, that is very true. Our hours we're going to be open 9 to 5, Monday through Friday. We're going to be holding some special health fairs in
cool.
October and November. We're going to try to advertise those on Facebook and things like that, so look out for those.
You can come on here and advertise it too.
Oh yeah, we're gonna definitely. We already have advertising dollars for KPVM. So
nice.
We're gonna be doing, and we'll have a billboard up and sign too. So we're gonna be doing a lot of health fairs. Anybody that's already enrolled with Nevada with healthcare.gov, this year you're definitely gonna want to talk to us and get some assistance. They're transitioning to a new program. So the first week of September, you're gonna get an email saying, hey, you have a new account with this new Nevada Health Link. Log in and verify your information. You're going to log in and they're going to say, do you want to auto-renew? You're going to probably say yes if you like your plan. But I guarantee you're going to want to go through those plans again, look at them. They're going to have them open to public to look online at October 3rd on the website. And you can do like your own little window shopping if you want to. But it's going to be a good idea to, after they window shop, just make sure you also, talk to us a little bit more. Because most people, they make a decision, they don't realize that they bought a plan, they don't realize that, number one, their doctors aren't in the network. They don't realize their medications aren't covered. Those are things that we always make sure that we go.
And you can have that. You have the provider list, you have a formulary for prescriptions, so you can look all that stuff up. Yeah. So I always have felt more comfortable meeting somebody in person. That's probably why I like to interview people.
There you go.
And you're right there in the center of town, so you can just go over to Battleborn Financial, make an appointment probably is better. Yeah. But if they walk in,
appointments are guaranteed. We're going to be also at the, we're going to have somebody staffed at the Walmart this year as well.
Okay.
There's a health insurance booth there. We're going to be, at our office as well. So we're going to be in multiple locations too. So as you're shopping at Walmart, you can stop by and say hi to us at the booth, and we'll help you there as well.
And working with Nevada Health Link, I'll tell you that in January, Nye County Health and Human Services does that social service fair. So you're going to call them to get in that definitely. Too. So you'll see them there because I'm going to tell them to go get signed up for that.
I want to make one note too before we go too, but also those people that are on Medicare over 65 this year, just to be aware that there are some new plans coming available this year. We have actually 4 new Medicare insurance carriers that have decided to enter the Nye County market, and so there's going to be a lot of changes even on Medicare. So people that aren't even on, under that
like
are
supplemental plans, like that you could do like AARP and stuff.
We have AARP right now. We're gonna United Healthcare is bringing out some new plans.
Oh, great.
We have Humana that's bringing out some great programs, and then we also even have we're gonna have Aetna in our market now this year.
Great.
We're gonna have Senior Care Plus. We're gonna have All Well is gonna be out here, Centene Corp. We're also gonna have I think we also have Select Health from Utah is going to be out here as well. So we're going to have a lot of different options for people. And, our office is still a great resource for all the plans. We never try to be one program, that's it, all we sell. We try to look at everything that you have. Again, go back to the idea of, you're going to know, we want to make sure your doctors are covered.
Informed choices is always better.
We want to make sure your doctor's covered. You want to make sure your medications are covered. Things that are important to you, we want to make sure those are important to make sure they're covered for you. Because it's hard too often to get people that, we're going to have a lot of different agents and stuff come up from Vegas during that time frame. They're going to want to try to put you here and there, and they're stout for your buck sometimes, unfortunately. And you got to be careful to make sure that they're actually walking through the steps and making sure they understand your situation. The brokers and stuff, we get paid to service the accounts too. So it's after that, even you might buy it from somewhere, you got to realize you got to get service somewhere, and that's why we're here local
and that's
to take
where
care
the
of that.
support comes from. So I feel like we need to have another show, so you'll see him back here soon, and after we go off air, we'll book a date. So, because I feel like there's a lot more things that we need to talk about.
Yeah, definitely.
So let's have your phone number live with the banner.
Thank you. Yeah.
What's your phone number?
775-419-6025.
All right. 775-419-6025.
That's it. Yep.
See, it's so easy to remember. Thank you so much for joining us.
Yep.
Battleborn Financial, right on the corner of Basin and 160.
Yep, right down the corner.
Right with the Children's Dentistry, right? By the park?
No, we're right across the street. We're right by the J.K. Nelson Attorney's
Oh,
Office.
that's right. That's right. Oh, that by Home Depot.
Yeah,
I'm
Home
so
Depot,
sorry.
yeah.
We already said that. The guys with the ties.
We'll have some big signs out and stuff, and then come
I'm sorry.
enrollment.
Sorry about that. I'm already getting confusing
October
myself.
15th to December 7th for Medicare, and there you go.
Thank you so much.
Thank you.
Good night.